Your local anesthesia armamentarium includes your syringe, the needle, your local anesthetic cartridge, your topical anesthetic, couple cotton tip applicators, gauze, and either the autoclave tape or a recapping device. The local anesthesia syringe comes in different sizes. This is your petite syringe and this is your medium syringe. You can see the differences in the thumb ring. This one's more oval where this one is more round. It's important that you choose one that accommodates the size of your hand. This syringe is the most common used in dentistry. It's called the breech loading syringe, which means that the glass cartridge of the anesthetic solution can be inserted on the side of the barrel there. Talking about the individual components of the syringe, you have your thumb ring here. This one is oval. You place your thumb through the ring to advance or retract the piston. You have your finger bar or your grips, which will actually hold the syringe. Use your index and middle finger, and this provides stability and control of the syringe. This whole piece is called the barrel, and then if you take a look, you have a large window which is facing us, and I'm going to flip this around. You have a small window. When we talk about setup of the syringe, it's important that the large window is facing down, so that way when you're delivering the local anesthesia, you can see through the large window there. This whole piece here inside is called the piston. Okay, that's what's connected to the thumb ring, and at the very end of the piston, this little arrow piece is called a harpoon. It's the sharp tip attached to the internal end of the piston. Okay, and this is what makes the syringe aspirating. This arrow point goes to the rubber stopper of the anesthetic cartridge, and you will pull back on the thumb ring to determine if it's a negative or positive aspiration there. And the very end of the syringe is the needle adapter or the hub. Okay, it's what secures the needle on top to the syringe securely. It is threaded, and you have to be careful when you're untwisting the cap needle at the end for removal. It can become loose and inadvertently be disposed of. The needles come encased in a plastic capsule. Okay, we opened two up. We have two here. They come in different sizes. We have a longer needle and a shorter needle. And talking about the parts of the needle, here's the part that gets injected into the patient's tissue. You have the needle hub and then the cartridge end of the needle. The needle, as you know, delivers the anesthetic solution from the cartridge to the surrounding tissues. The type of injection, how much tissue needs to be penetrated, will determine whether you want a short or a long needle to be used. These two needles have indicators on them. You can see on the yellow one there's a little arrow pointing down that lets you know where the bevel is, and on the shorter needle is a little red dot. That is important because to increase patient comfort during injections, you want the bevel of the needle should be toward the bone. You are never going to bend the needle, okay, because it increases the risk of breakage, and you'll never ever insert the needle all the way up to the hub. Okay, greatest risk of needle breakage. Standard of care is never go more than 2/3 of the length of the needle. Needles, you should be using sharp, sterilized needles. Okay, single use, disposable. You want to change after 3 to 4 tissue penetrations because they do become dull. Here we have two samples of local anesthetic solutions. Notice that they are by different suppliers, but the color coding is a universal system, so no matter what manufacturer you purchase them from, xylocaine will always be red and mepivacaine will always be this brown color. You'll notice too that some of the colors are very similar to one another, so you want to definitely look at what you grab before inserting it into your syringe. Notice with the boxes that it will tell you, besides the name, the trade and generic drug names, it talks about the drug concentration and talks about expiration dates. Those on the side of the box can be found on the side of the box. but each individual cartridge, the anesthetic cartridge, comes in blister packs, and it's important that they should always be stored in original containers and they be stored at room temperature in dark places. This keeps the cartridges clean and uncontaminated and prevents premature deterioration of the solution. And here's an individual glass cartridge cylinder. Okay, this is mepivacaine. Again, the color coding, you can see by my thumb, matches the outside of the box. Has the name of the drug, mepivacaine HCl 3% injection. It states that it's without a vasoconstrictor. Okay, it has a barcode. All anesthetic solutions have a barcode for the manufacturer. And then you can see it has the expiration date here of April 2016 here. Parts of the anesthetic cartridge include the silicone rubber stopper. It's located at the bottom of the anesthetic cartridge where the harpoon is engaged. At the front of the anesthetic cartridge, you have two parts here. You have the aluminum cap and then the rubber diaphragm. The rubber diaphragm is made of a semi-permeable material, and that's where the part where the needle gets inserted. The aluminum cap is what holds the rubber diaphragm in place. It fits securely around that. Again, it is important that when you are storing your anesthetic cartridges, you do not place them in any type of solution, because what will happen is the solution will cross-contaminate, go through that semi-permeable surface and go into your anesthetic solution. It can also corrode the cap there. Commercial warmers are not necessary. This cartridge does not need to be prepared at all. And then you should always read your manufacturer's insert with that. When we talk about cartridge problems, you can see that the solution is nice and clear. Okay, you don't see any bubbles right now, but if sometimes there can be a small bubble, if it's 1 to 2 millimeters in diameter, this cartridge is fine to use. But if you had anything greater than 2 millimeters, you would not want to utilize. If the rubber stopper is, see how it's in placed a couple millimeters, if it's extruded, you would not want to utilize. Or when you go to engage the harpoon and this rubber stopper doesn't move, it's more sticky, you wouldn't want to use this anesthetic solution. And then obviously if the cartridge was broken, you would not want to utilize, or if there was leakage or a cloudy solution, you would not want to use this cartridge. You would grab a new one and inspect it. Sequence of loading a syringe. What you're going to do is you're going to go ahead, pick up the syringe, place your thumb in the thumb ring, slowly pull back on the thumb ring, so that way you pull back on the harpoon and the piston, and you're going to insert the cartridge rubber stopper in first. Pull back so that fits, like that. You're going to take your non-dominant hand and cover the glass, the large window with the glass cartridge, and you are just going to tap gently on the thumb ring. What we're checking to see is if the harpoon engaged in the rubber stopper. So I'm going to turn that so you can see that, and all I'm going to do is just slowly pull back there, and you can see that it did engage because the cartridge comes back there. So that's perfect there. We are going to now attach the needle. There's a long cap and a short cap. What you're going to do is unloosen it. Just twist with your non-dominant hand on the short side. Pull that right off. It's important to get a fulcrum here. What you're going to do is use your fulcrum against the side of the syringe and gently place that on to the needle adapter. You want to try to go in straight as you can, and then just twist that in place here while maintaining that fulcrum. And you go, and that's nice and tight. I can't turn it anymore. One-handed, what you want to do is loosen that cap. And what you're going to do is you're going to use your dominant hand, thumb, and index finger, and you're going to just wiggle it from side to side, loosening that. May take a little bit, and it's loose there. Now what you're going to do is, you can see that I have the large window facing up. I'm going to turn it in my hand and place it down so the large window is facing down against the tray. Okay, and I am using autoclave tape as my recapping device, and you can see that'll stick right there. Next, what you want to do is place, again, a fulcrum on the tray. Pick up your syringe. The reason for the fulcrum is that you don't drag this needle across the tray cover and contaminate that. So I got my syringe, I got my fulcrum. I'm going to pull out the needle and come across. Okay. And I'm going to go ahead. I can see my large window is facing me. That's perfect. I'm going to secure a fulcrum. I'm going to penetrate 1 to 2 millimeters into the tomato here, and I'm going to slightly pull back on the thumb ring. You can see that there's bubbles there. I have a negative aspiration, and then I'm just going to slowly start depositing the solution there, and you can see that it's pulling out here. The molar is a two-step process, so we infiltrated the 1 to 2 millimeters. What we're going to do is we're going to advance the needle another 1 to 2 millimeters, and then we need to re-aspirate up, and you can see that I have a positive aspiration there. When I pull back on that thumb ring, I have a positive aspiration. So what I'm going to do is just keeping back out just slightly and reposition either to the left or to the right, and then again pull back on that thumb ring, and I have a negative aspiration now, and I can slowly deposit that solution. All right, before I go on to my next injection site, I'm going to take a look to see if I have any anesthetic solution left in the cartridge, and I do not. So I'm going to show you how to change the anesthetic cartridge. So what you're going to do is you're going to go in and recap the needle. Place it in there. Again, it's all one-handed, and I'm going to stand this up and make sure that this is secure on there. We don't want any occupational exposure. So what I'm going to do is, with my non-dominant hand, I'm going to hold the barrel, and with my dominant hand, I'm going to pull back on this thumb ring to disengage the harpoon. And it just didn't disengage. And what I'm going to do is pull back on the thumb ring so that cartridge can come right out. Sometimes the needle end is still in the semi-permeable rubber diaphragm. That's fine. I'm just going to pull that out. I still have this piston and harpoon retracted, and I'm going to put in the next cartridge. Let go, and again I need to use my non-dominant hand, cover that glass barrel, and tap on it to engage the harpoon up. So you can see that I didn't push hard enough, so I got to tap a little bit more here. And when I pull back, you can see that it's engaged, and you can also see the bubbles here that it created too. So now I'm ready to move on to my next injection site. So I got to recap the needle one-handed. Again, using my thumb and index fingers to move back and forth. I've loosened it. I'm going to place it down, and it's attached. Establish a fulcrum, and so that way I don't drag the needle across the tray cover. Come back. Again, I can see that large window. The barcode is facing me a little bit, which does block my view. So what I'm going to do is I'm just going to take my non-dominant hand on the thumb ring and just slightly turn the thumb ring here, so that way that's not in my way. Establish a fulcrum. Penetrate the tissues 1 to 2 millimeters. Slowly pull back on the thumb ring to create that negative pressure. Okay, and sometimes you see bubbles, sometimes you don't. Right now I'm not. And I'm going to slowly deposit that solution. Again, the reason it's slow, so you don't tear that tissue as you're depositing that solution in there. The rate is 1 millimeter a minute. You want that solution to puddle rather than tear through the tissue. And you can see my rubber stopper slowly moving there. That's a good rate there. So I'm finishing my last injection site here. I'm getting ready to perform scaling and root planing. So what I'm going to do is pull this out. We're going to put the cap back on. You always want to make sure that cap is securely on before you start any procedure. So I'm going to stand this back up, get that on. Perfect. Patient's completely numb, thus why I recapped it. I perform my procedure, the scaling and root planing, and now the patient is dismissed, and I'm going to show you how to unload the syringe. The first thing you want to do is remove the needle. Okay, it's important that the cap is on securely, and that's why I stood it up earlier. What you want to do is just start untwisting it. If you notice that the cap is wiggly or loose, stand it, put the syringe back down and stand it back up to make sure that it's really on there. And you can see that I'm pushing it on there. So untwist the needle, and you're going to put that into the sharps container. Notice how close I am to the needle adapter. I'm not up here untwisting it. So I'm untwisting here. I'm going to again use my fulcrum because I have to wiggle it off a little bit and just put it right into there. You never ever recap the other end. You just throw it right into the sharps container. Okay, and I want to make sure that the needle adapter is still there, that I didn't inadvertently throw that out. If that did occur, the syringe is no good anymore. You're never ever going to go into a sharps container looking for this. Just throw out the syringe there. So the needle is removed first, and now I'm going to pull back on my thumb ring and disengage that harpoon. Again, I'm just doing it one-handed. You can hear that it clicked, popped out. And then I'm just going to tip it like that and throw that out. Before I throw that out, I need to look for my documentation to see how much anesthetic solution that I utilized here. So I used a whole cartridge before, this would be 1 3/4. So I would document that in my progress notes according to your notes in the study guide that I gave you. Okay, and then you throw that out. And then you would take your syringe, wipe it down, and sterilize that. And that is it.